medical mystery, so we're all going to work on it together. And I love this format, Catherine. This is like brilliant, to be honest with you, to have an interactive discussion. So we're all going to work on it together. I'm a general practitioner just like you, so it'll be interesting to see how we arrive to the diagnosis together. So we're going to like kind of peel back the curtain. We're going to do some quiz, ask you some questions. I'm going to put on the dramatic cap and be a pet parent for you guys. So be prepared for the acting to begin. But yeah, so that's what we're going to do. And we're going to like learn a little bit too about this. So it'll be fun.
This is the best part about this whole thing, and we're now live on Facebook for all of you who want to crack this case. So what is so fun about this is I feel like in practice, we are dealing with, unfortunately, sometimes some pet parents that are really under a lot of stress. So you get tonight, when we're walking through this, money is of no object. As we go through what tests that needs to be run, what are we looking at? The opportunity is now for you to be able to say, what do I want to run a test on to figure out what this is all about? So this is going to be so much fun. First and foremost, I do want, and I know we've got a group here, but if you could tell us what role you play in the practice, because there will be specifically called out roles for you. So the first question for everyone to put in the chat is, what role do you play in your practice? And then what we're going to do is Adam is going to go ahead and go through and tell us the scenario. We're going to pause and we will send out a poll for you to be able to tell us what is the next step. So before we do that, everybody raise your glass. It is time for our toast. So we're going to go ahead and turn this on over. Adam, what's your toast?
So this one's important to me because this one's about time. So I tend to cherish time as one of the most cherishable tools anyone can have in this life. Why ruin the journey by watching the clock and ticking away of the years? It is a waste of time to be fixated on time. Life is about the moments we create, the friendships we establish, and the ability to cherish time close to our hearts, more so now than ever during this pandemic. So here's to taking the time to connect, building meaningful relationships, and smile.
Cheers.
Cheers.
Oh, that sucker's getting re-edited and we're putting that sucker out.
Good soundbite, right?
I love that. I absolutely love that. Okay. So my friend, we have a case. We get a phone call. Everyone get ready. Here we go.
Okay, so the phone is ringing, and so whoever this is, you're all answering the phone first, okay? So you're all playing receptionist, doctor, whatever. And I'm Mr. Smith, and I'm calling Bridge Club Veterinary Hospital. And I say, oh my God, I'm coming down right now. I'm coming right down. I have Connors, my 7-year-old dachshund, and I just came home from work, and oh my gosh, there is blood everywhere. There is blood everywhere. I don't know where it's coming from, you guys, but can I come in, please? I need to come in. I think he's dying. I think he's dying. Good dramatic.
Wait, is he barking?
Oh, and by the way, can you trim his nails? Okay, I'll be right down. I'll be right down.
Okay. So we're going to stop.
Yeah.
That is what you've been told.
Yeah.
Oh my God, I really love Mayumi's background. You're making me love your background like beyond. Okay. So I'm going to launch this poll. I want everyone to look. What are the top 4 things that you are going to ask the pet parent?
Oh, I like
Get
that.
4.
So can you stop the bleeding? Where is the source of bleeding? How long has he been bleeding? Can you check the gums? Are there other animals in the house? Has he recently been vaccinated? What was he doing before this began? Are there other animals in the house? Ooh, so what are you going to ask me?
Okay, okay.
I like playing this game.
You what?
I like playing this game.
Okay, so I'm going to end the poll, and and it should hopefully show everyone the results. So let's see if it's sharing the results. Can you all see those, or do I need to read them out?
Yeah.
I think we can see him.
Okay. So, Adam, Dr. Adam.
So the source of the bleeding, can you stop the bleeding? How long has it been bleeding? Can you check the gums? Great questions. So yes, I could do all those things. Oh my God, I think it's coming from his head. I can't really tell. I can't stop the bleeding. No, I don't know what to do. I have a towel wrapped around his whole body because he's a dachshund. His gums, I don't know. They look okay. Or they're wet. Is that normal? I don't know. And yes, he's the only dog in the house. He's the only other dog in the house. What was he doing before? I don't know. I just came home from work, so I don't know what he was doing. He was probably playing chess. I don't know, but I'm coming down.
Okay, so with that though, what we need to now go into, because as we go through that, the idea was we want to be able to talk about what did the actual physical exam. They come in, they freaked out, they came barging in.
Yeah. So
blood everywhere.
Yeah. So I'm in the hospital. Here I am as a pet owner, and I bring him to you. And this is what you're going to see a little bit first on first appearance or whatever. So you find out that he's a neuter dachshund. He's current on his vaccines, received his rabies vaccine and checkup 2 weeks ago. He's the only pet in the household. And on physical exam, his temperature is 101.8, pink, moist mucous membranes. His CRT is less than 2. A little bit of dental disease, slightly tachycardic, panting, heart rate, lungs, WNL within normal limits, compliant abdominal palpation. He has bilateral hemorrhage to both of his ears, alopecia, hyperpigmentation. He also has mild acanthosis nigrans to his sternum with alopecia, flea negative. So severe hemorrhage is coming from his ears, both of them.
Okay, so now, because apparently I can't use the poll the way I wanted to, I'm going to post in here.
Hey, I have a question. Can I have a question?
Certainly.
Hey, Adam, it's Chatfield. Okay.
Oh my God!
I know. I missed the beginning. Look, we had the whole link situation, and I know I'm not the only person that had the link situation, right?
Sorry, that's my fault. That's this one.
It happens. I mean, give me a break. It happens. Okay.
Unless,
His dog was he came home, his dog's bleeding all over the house.
bleeding, and then I'm physical exam. He's bleeding from his ears.
Okay, that's what I was getting at. Okay. Okay. He's bleeding from his ears, and that's why they brought him in. Okay.
Yes. So,
but he also needs a nail trim because that's super, super important.
right. He just
Yeah.
had his.
Oh, by the way, could you trim his nails? Could you put the shot? Could you go ahead and put the shot? Right?
Put the shot.
Yeah.
Okay, so the question is, what are the different diagnoses?
Yeah. So what are your rule outs?
Trauma.
Okay, good. I love it.
Okay, what else? And you can spit them out. You don't have to write it in. Spit it on them out. We got trauma.
Good. Mm.
Anything else? What about?
There's no other sign?
What about inflammatory?
Yes.
Yep.
What else?
Come on, you thinkers here.
Anthrax.
Got a bleeding disorder.
Yeah,
COVID,
bleeding disorder.
I'm just saying, throw it all out there at this point.
Good.
Rodenticide.
IMHA.
Hematoma.
Right. Okay, good. So, excellent. So we triage him a little bit further to figure out that the bleeding is more specific to his ear tips. Bilateral ear tips is where he's bleeding from. So
That doesn't sound exciting, Adam.
it's really kind of not, and it is in a way.
If it's all over your carpet, it is.
Yeah, I mean, I'll share my screen at one point. I'll show you what it looks like, but it's a bloodbath. But yeah, easy.
Adam, are the ridges of the pinna, are they like black and necrotic at all?
Yes.
Okay.
Yeah.
That
Super.
sounds like a clue.
Mm-hmm.
Here's a clue. I found Jen with the candlestick in the study.
Oh
Yeah.
my God, I was just going to say Colonel Mustard.
We have ESPN.
I love it.
So that can be potentially related to some like microvascular issue in the pinna. I saw it when I was out in California a lot of times with Chihuahuas that we would vaccinate, and a couple weeks later we would get some pinnal bleeding and some necrosis around the ear tips, which was some sort of, I forgot what it was, some sort of immune complex.
Well, that's why you're here, Shapley. We're chatting about this.
Yeah.
That's,
I forgot what it's called though.
hey, but wait, did you just give it a bunch of steroids and fix it?
So this is what I did. So
Okay, don't say it yet because we got to
Wait,
keep it short.
Jennifer, you look like you're ready to go on camera.
she probably
Yeah, she
is.
is. She's got a better
Oh, I'm
microphone than I do.
Oh, there she is.
Okay, so wait a second, really quick. We've had a few people join us in because I'm sure it's all because of the link issue. Let's quickly give the summary of what the case is
Sure.
and where we are in the process because I want to be sure people are really able. Sorry, guys, it's our first time doing it. We're like checking it out.
Listen, we're all good. So he's
It's
a
awesome.
7-year-old neuter dachshund, came in on emergency with bilateral hemorrhage from his ear pinna is what we basically boiled it down to. Only dog in the house, and the owner was unable to control hemostasis at home. So totally freaking out. And so right now we're just kind of talking about what our treatment plan would do. Obviously, when I try to control the bleeding, and those are annoying because every time you dab it, they do a little shake, 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 and then bloodbath again. So
And then is it Shapley?
Shapley, yeah.
Dr. Shapley made the astute observation and said, is it like black and kind of necrotic and nasty on the pinna, right? And you said yes.
yes, there's
Mhm.
Now, are we showing them anything, Dr. Adam?
I have a picture. I do have a picture.
Okay, are we doing the picture yet before we have them do their diagnosis?
Yeah.
Oh,
Yeah.
picture first. Yeah,
They're
picture.
gonna,
It's cheating if we don't see the picture, Adam. It's cheating.
I know. Am
I
I?
really like Jennifer a lot. I like she's calling me.
He is a People's Choice Award nomination, by the way. Anybody-
Wow.
Yeah.
No, the real question is people's choice for what?
Wait, it looks like your other dachshund took a bite out of this ear.
Yeah. So
Dr. Shapley, is that what you thought it would look like?
No,
Okay.
no. Because that looks more like a tear or a bite wound.
Yeah.
But I'm of course looking at this on my phone, so, but yeah, no. Yeah,
Yeah.
that's all I thought it looked like.
so
Nasty.
Okay, so I'm going to put in the chat. You're now seeing the picture. Keep talking there, Dr. Adam, but I want to be
yeah, we
sure
were
that they're
talking
starting to
about-
think about the diagnosis.
differential diagnosis, and this is, I also wrote down what our triage steps were done. So hemostasis was maintained with pressure, silver nitrate sticks, your typical things that we could do. Anybody got anything like bandages, Band-Aids, something, because that's what you try to do when you have hemostasis. And then it
Maybe
wasn't,
need the no flap ear wrap.
right, there you go.
Yeah. But I have a question. So that right there does not look like it would be a bloodbath. It would look nasty and there'd be blood flinging,
Yeah.
but it doesn't look like there'd be the volume of blood would be that large, like
You know-
that big, right? Is it really bleeding like crazy?
Yeah. Oh, yeah.
I mean, it's like a real gusher because I don't see
It
anything.
wasn't like, no, didn't have a pressure to it, like a heartbeat, but
Oh, okay.
every time you just kept applying pressure, it would just really start to ooze heavily. So to
And-
an owner, of course, that's why in the beginning I was dramatic because it feels like.
And if you're playing the client, what a bloodbath to a client is totally different than what a bloodbath is to the veterinary professional.
Yeah. Oh, I don't disagree. Well, that's what I'm saying.
Yeah.
Like, but now, like everybody, right? Like, if you look at that ear, anybody freaking out from the blood? Was it bilateral? Yes.
Yeah, bilateral. It was bilateral.
So you're thinking vasculitis or something, Dr. Hanlon?
That's what they have. They have in there yet. And you guys can speak up. You don't have to hide, but if it's easier, it's
I mean, that's what I'm thinking is some sort of vasculitis, and I'm, and I mean, it might be.
Oh, who just said that? Raise your paw. Somebody give her.
Rhonda actually put that in the chat too. She said ear margin
Oh.
vasculitis secondary to vaccine immune-mediated
Vaccination.
disease.
Yeah.
Skin
So
biopsy question mark.
If you
I
heard,
didn't look in the chat. I did not look in the chat.
You
I
guys
know.
both had it at the same time.
I love it because in my history, I said it very quickly. I was just here 2 weeks ago with a rabies vaccine and a wellness checkup.
Well, and like I said before, that's similar to what I saw in like Chihuahuas when I was in California. After we vaccinate them, we would see that kind of
Yes.
immune-mediated vasculitis in the pinal margin.
Yeah.
Also in rhinos, black rhinos.
So,
Oh,
those don't
really?
know, by the way, I got to tell you, Dr. Jen Chatfield is a zoo specialist, and like I love
But
her.
I knew that before.
It's incredible. Anyway, we got to shout out to you, Jen, because you're fantastic. We love you. So that's why she says rhinos.
That translates to stop talking, Chatfield. You're talking too much, right? I'm seeing Shannon. Shannon's like, what's happening right now? Right?
No, so what we love about, so for those of you who don't know, I should say that Shannon is our director of technical education. So she loves all of this. So this is like amazing sauce for her. And
love
then
it.
Dr. Cheryl is also our CBO. So I do,
Okay.
you're probably like,
Johnson, I gotta say hello to you too. One of my clients and friends is here for pet parents in the house. So we love you, Christina Johnson. So thanks for joining us.
Kid in the doorway.
Gosh,
Okay.
that's awesome.
okay, so as we're going through this, guys, I want to be sure. So this is what they are like narrowing in on. So let's start giving more details here, Adam, as to what actually happened.
So I went ahead and biopsied this ear. I took the ear off. I just said, you know what? Can't stop the bleeding. So we did bilateral, just the lower 1/3 of the ears, took them to surgery, biopsied it, and it came back as, should I tell them?
Yeah.
So neutrophilic cutaneous vasculitis to the ear pinnae, or also histologically known as mononuclear non-leukocytoclastic cells that are noticed, that are there. So good call, everybody.
Oh, is that what we said? Because that sounds like a whole lot of big ass doctor words.
It was just on Wheel of Fortune. So yes.
Just saying.
But wait, what are you going to tell the client? Because
Yeah.
you can't say
Oh,
that.
yeah.
So this is what I want to talk to you guys about. I want to know what you would tell the pet parent to be like, how did my dog get this? Everything was fine. I don't have any other animals at home. What do you mean? Like, for instance, I was just here a couple weeks ago. What did you do back there that caused him to have this
Yeah.
reaction?
Yeah.
Mhm.
I
And
want-
how did a vaccine in the right hip cause beep?
Thank
Well-
you, Dr. Cheryl.
Yeah.
No, clearly, A, we torture dogs in the back, and B, here's the toll-free number to the vaccine manufacturer.
And plan B of that messaging would be,
Yeah.
I gave that. That was the toll-free number.
Yeah. I mean,
I mean, one of the things that's important to say is that something like this is extremely rare and we can't prepare for the unknown. Unfortunately, this is one of the side effects that we extremely rare, but something that we have to be prepared for, unfortunately. And yeah, it is a matter of contacting the vaccine manufacturer to hopefully compensate the owner as well as report this, because it could be a bad batch, could be something that's going on with this particular tray of vaccine. On a side note, I would probably chuck that tray out if we haven't gone through it, but it is one of those rare things, and that's what we have to let the client know.
Yeah.
I would love it if Demetria could actually chime in. I am curious. So she's in Greece and she's saying it's difficult for the pet parents to believe that. So I'd love to get a little bit of Demetria because I love the global perspective on this. So if you can unmute, I'd love for you to share.
Yeah. And it's just not in Greece. It's also here in the US too, like Dr. Jen said, because,
She may not be able to unmute.
well,
Oh, it
think
says,
about-
yeah.
She's generally a student. You know what? You're not only a student, you're in veterinary profession. So come on in. It's totally cool. We love hearing everyone's points of view.
everyone's welcome.
Yeah, but I
Everyone.
have a question.
Yeah.
So because this is pretty rare with a rabies vaccine, but it does happen, right? So Dr. Shapley, you saw this in a bunch of Chihuahuas?
I mean, I don't want to make it sound like it's every single Chihuahua I ever vaccinated, but yeah, when I was in Southern California, I either saw pit bulls or I saw Chihuahuas. That's what I felt like. I was mostly
I've been in
doing,
South Texas. I agree. Go ahead.
Yeah, I mean, I was mostly doing horses and cattle, but I still saw the occasional Chihuahua pit bull, and I would have to say that it was a small percentage, but I definitely saw this, vascular necrosis, and it was typically in any of our Chihuahuas that were. It wasn't in the puppies, but we definitely saw them when they're, coming in for that second rabies. So like, when they were
The 1 year?
Yeah, the 1 year, like when they were coming in for their after the 1 year. So they get their puppy one and then the one after that.
The 1 year
That's
booster.
when- yeah, exactly. That's when I would start seeing that.
Because they were
Rare, but-
hypersensitized, right? Because they were hypersensitized
Yeah,
by the
exactly.
first one.
Yeah, so it never happened in the first one, but very, very small percentage, I did see, this happen.
Yeah.
Poodles.
That's my question, Dr. Hanlon.
I was gonna say poodles and the teacup poodles. I've seen a lot of vasculitis at the injection site.
Mhm.
What's that look like? A big giant bruise or what?
No, just hair loss, and then the skin turns black, and the hair doesn't grow
Owners
back.
hate that. Ooh.
The owner, especially in those white poodles, it's not good.
Yeah.
So I think Dr. Hanna, Mark asked a really good question with regards, is this only happening in rabies vaccines?
No, so this could be in other vaccines too. So distemper vaccines, it's been reported in as well. There's, I gave you guys a link too from Veterinary Dermatology, and it's a retrospective study on canine and feline cutaneous vasculitis. And it's a pretty solid study where there was 21 cases of cutaneous vasculitis in small animals that were reviewed. And greater than 50% of the cases were idiopathic, but 5 were from rabies vaccines, 2 associated with hypersensitivity to beef, 1 was associated with lymphosarcoma, and 2 associated with administration of oral drugs too, ivermectin and itraconazole. So, there could be a drug reaction that can cause this too. There's another paper on thromboischemic pinal necrosis in fenbendazole treatment in an 11-week-old West Highland Terrier. So it's been reported in distemper too. So yeah.
But fenbendazole is tricky in a lot of species.
It is, right, Dr. Jen?
Yeah, bone marrow suppression in a whole lot of species. It is not my first choice.
Really?
Mm.
What does it do in like some of the other species?
Bone marrow dyscrasia.
Oh, really?
Even at published doses, yeah.
Which one is on the top of the list that comes to your mind?
I know. Don't you want to know that? Wouldn't that be handy? Yeah. I'm sorry. I had a couple glasses of wine in fairness, Dr. Christman, and gave another lecture, so I'm a little punchy.
So good.
Well, welcome to the Bridge Club, because that's what happens. So we're all
right, I
about
didn't
our
know.
toast.
Wait, should we all just drink again?
Yeah, well, I think maybe that's another toast right there. We'll just,
There was a hole in my bottle. Apparently, y'all's was intact.
Ooh, I love that song. I love that song.
So I'm really happy that Demetria put on her camera, and she says, but listen, it's very important, because that's what the Bridge Club is all about. It's all about like getting to know each other and really seeing one another.
So you can see fenbendazole induced bone marrow dyscrasia in especially young macropods. You can see it in lots of reptiles like the giant chelonians. That's the giant tortoises. And other reptiles like the lizards, the iguanids, and stuff like that. You just be aware if you use fenbendazole. And in point of fact, a very prominent national park with mouse ears killed all of their marabou storks in a single day.
What?
You guessed it, by administering fenbendazole. Boom. And then they published it.
That is so sad. That is just so sad.
It is, because do you know how much those marabou
sadness.
storks are worth? Woo, that's some money.
I feel like you're doing squats.
I am. because Adam knows this, because these mics are obnoxious for women to be seen speaking into on a thing, right? Yeah.
It's very funny.
Just don't get so close.
Yeah.
Just stand back.
So what I love about this
so
case
much better
is we're really trying to bring more medical mysteries forward. This is the type of thing where people would not necessarily anticipate it. And I feel like, knowing that we've got the pet parent side of the communications that we also do, this would be really interesting to also bring forward to them, because I think that as we look at vaccines, we look at preventative care, and it's something that the profession is very much in favor of, but there are risks associated, and necessarily, I am curious, when you do give vaccines, are we talking about those risks, and how are we talking about those risks? Because Adam, you mentioned this is being seen more than normal, or more than what we've seen in the past.
Absolutely, it is. And, I'm seeing it more just because I'm a dachshund guy, and it is very prevalent in dachshund species. And we have Christina Johnson here. She's great. She's a friend of mine. She's a pet owner. And Christina, we talk about this a lot too, about vaccines. And she asks all the time, does my dog really need this? From a pet owner's perspective, she asks, do my kids need this?
Good question.
It's a great question.
You're on mute, Christine.
Yeah, so that's a great question. And hello, everyone. I'm a big advocate, and I hate to say it, but I'm not about the medicine for my dog, just like I'm not for myself, unless it's really mandatory for them to need it. I have 3 dogs now. I've had 3 dogs in packs of 3s, and they're very specific, and each one's very sensitive. But to give them medicine, they can't speak, right? So we don't know what's bothering them. And the long-term effects is kind of sad because their lives are so short. So I'm very not about it unless someone says it's very imperative.
Yeah, no, thank you for sharing that, because it's true. And I tell her this, I said, I'm a veterinarian, not a vaccinarian, because sometimes there's like this stigma that happens for some reason in veterinary medicine that they associate us with this, oh, they're just looking to make more money. They're just looking to make more money, a vaccine. And that's not the case, of course. So, not every dog is the same for the vaccine. So it's great having these conversations. So Christine and I have a great conversation. We chat about it, like, is she going to be hunting with her dog? Is she going to be taking them out to dog parks? All that stuff. Like, I think it's a great thing. This leads us tonight to have these. The point is, have a conversation with the pet parent about these things, because they're Googling this stuff and they're going to read this and they're going to see this. This is going to be the first thing that they're going to see. And you're going to be like, oh no, that's not going to happen. But what if it is? What if it is on your watch and that does happen? And just like to Catherine's point, we should maybe have these discussions about, these are some potential side effects other than the acute type 1 hypersensitivity reactions that we're used to seeing. This is a type 3. So we're not going to see this right away. This is going to be a few days, maybe a few weeks later on, or even a couple of years. So it's just important to kind of keep that under all of our radars, from pet parent to veterinarian and veterinary technician, everyone in between.
Okay, so I'm going to ask what potentially is a really naive question in this, but I'm allowed because I own this company, so that's fine. My question on this one in particular is, but I think in all states, rabies vaccines are mandated. Yes.
Required.
So now we're saying.
Sort of. Required, sort of.
What do you mean by that?
Sort of. Hi, my name's Jennifer. I'm your public health veterinarian for the night. No, I'm just kidding. But you don't have to vaccinate your dog for rabies. You don't have to vaccinate your cat.
I thought you had to get the tag.
Wait, meep.
Oh, I'm sorry.
Just a minute. Because laws and regulations and local jurisdictional authorities are all interesting. So the risk that you run is you could pay a $10 fine or whatever. It's usually like not that much. That's not the real risk. The real risk is that if your pet has a bad day and bites somebody, then your pet is considered unvaccinated and in danger of losing their head. That's the risk that you run. So when people, and the same risk exists if you have a pet that is of a species not recognized by your state.
Yeah.
So if you have a Bengal cat, I like cats. If you have a Bengal cat, if you have a wolf hybrid, if you have a name something else for which the vaccine is not labeled, anything besides a dog, cat, or a ferret, then your pet, by a number of states, not all of them, but by a number of them, is considered unvaccinated, no matter what. So don't let people play with your pet unless you know that they or their parents are not going to demand your pet's head literally when they are bit in the face.
Interesting. Okay. Good.
Because they
good
will be
insight.
considered unvaccinated.
I live in Chicago, and so we're mandated for everything.
So I'm from Texas. Mandated is interesting. It don't mean I got to do it.
Illinois, it's you better do it or you're gone. So, and I should just move to Texas because that would be a lot more fun. But I do
Can I
think
interject on this?
Yes.
Yeah.
Good. Couple things. So about 20 years ago, I had a case that I chose not to give rabies. I graduated in 94. I'm an Iowa State grad, just about me. I'm practicing out just near DC, Northern Virginia area. So about 20 years ago, I had a cancer cat. I mean, it was dying. It was going to be dying. It was like 16, lymphoma, very elderly client. Rabies came up due, and her and I discussed it. We decided to hold off. And I thought, it's dying. Literally, we probably have 2 months left. So why would I give it rabies? Well, unfortunately, the cat came in for euthanasia. The elderly woman is sitting in the exam room with her cat. She's sitting there having a good time, holding the cat. I wasn't in the room. No one was in the room, just her. I hear her suddenly scream. I go in the room. She is spurting blood from her wrist. The cat aggressively attacked her out of nowhere. I have to call an ambulance. I am suddenly up in front of the Virginia board because I chose not to give that cat rabies. And they wanted to know why I didn't give the cat rabies. And I'm like, I was dying of cancer. And they're like, yeah, but the cat bit the owner. It was just a nightmare. The owner her only wish was that the cat could be cremated and buried with her. Instead, they took the cat, had it tested for rabies. So I'm just going to say, be very careful with, there's all these things that, yes, I think personally, I'm almost practicing, it's been a while. We're all, none of us are super young, except for maybe Kathleen down there. And we try, but the reality is,
like, thank you.
I know.
Right?
I'm like, what do we chop liver? Hello.
Hey, but be careful.
You're so sweet.
Be careful to choose
Yeah.
not to give rabies, right? Because it'll come back and bite you in the ass.
Hey,
And
Dr.
my
Pierce.
rule of thumb is,
I just have a quick question. Tell us your rule. Tell us your rule of thumb.
okay, here's my rule of thumb with rabies at this point. I really don't care if they're on their death edge. I'm going to give you rabies. If it's Virginia law, I'm not going to break it. Unless they're immune-mediated reactions, pets. If they're having reactions, I'm going to get a waiver. You can get a waiver in Virginia, and there's other states you can get waivers. So if there's something like that, get your freaking waiver, make the effort, get it done, so you don't in front of a board like I did, trying to explain why I didn't give the dying cat rabies.
So here's sort of the other side of this.
Yeah.
I just saw a couple of patients, what is today? Thursday, yesterday. This was two small dogs, mother and child, one's 14, one's 13. Yeah. And the 14-year-old, they came in for rabies vaccines and wellness exams. And the 14-year-old is having a lot of issues. So I decided not to vaccinate that dog. The 13-year-old is doing great. So I'm like, okay, we are going to give the rabies vaccine to this kid. 1 hour later, the owner calls, oh my God.
That's the one that bit somebody.
And this dog's never had a reaction before, and it's freaking 13.
Yeah.
Back in the hospital, Benadryl, blah, blah, blah. So yeah, weird things happen.
But I have a question, especially Dr. Pierce. So, and where is Christina still on, right? There you are. So we moved because we had a new person join, I think. And so it moved like all of my tiles. It's a little bit like Hollywood Squares on steroids. Here's my question. As a veterinarian, there is no pet I make decisions for, period, except my own. And even then I'm not good at it, but that's the only pet I make decisions for. Otherwise, any decision to decline a vaccine of any kind is only made and only can be made by the person who has the authority to make decisions for the pet, who is the owner. I'm not going to decide not to vaccinate. I can make recommendations.
Agreed from my perspective.
So how did the board, did you, I would come and be your attorney because.
Right. But
come on.
They didn't take my license away. I didn't get fined. They brought me in. They wanted to know why I chose not to give it.
Oh, owner declined.
The owner and I had talked about it. Elderly client. Her and I decided the pet didn't need it. The cat's never bit anybody in its entire life until that day. Who knows what set the cat off? Maybe it was pain. God knows. But it was just so frustrating. But I do want to say to you guys, I had a problem with distemper recently. I've never had a problem with distemper my entire life. I just had a 2-year-old dog. I think that, Christopher, you had said something about, the second time. So this dog had a series as a puppy. It was a bull terrier, came in for that big 3-year distemper. And, has done well his entire life. He got rabies and distemper, went home. 5 days later, he came back. He couldn't use his back legs. He was shuffling along like an old dog. And this was a sweet bull terrier. Looked like the Target dog.
Of course, because if he was an asshole, then it would have been fine. He never would have had a reaction.
If he'd been meaner than hell, he would have been fine. But this dog was sweet. And I ended up, at that point, I I did a 40X and put him on Doxy and Rimadyl, said, you know, he'll probably get better. He did not. He progressively got worse. So I did all these joint taps, cultures, the whole bit, came back as a non-infectious, heterogeneous mixed population, so not cancer. I sent it off to the neurologist. They did brain and joint and everything else, did distemper testing, no wild distemper. And this dog progressed to the point where he couldn't even lift his head, and we euthanized it. And it did not get better with any drug under the sun. And I talked to Merck, and I'm trying to get Merck to actually comp them some back. This has got to be, it's immune-mediated polyarthritis is what it is. And it didn't respond to any of the drugs. It progressed to GME when they did do testing, but they all think it's related to the distemper.
Wow.
No, no steroids. Did you give a whopping dose?
Oh, I blasted this kid. This kid was getting over a mg per kg, and I added in cyclosporine as well. So, I mean, this kid was so, I mean, and nothing touched this dog.
Oh.
So, and the neurologist was like, I think it's time, and it was just a mess.
Oh.
So Adam, what did you
brutal.
treat this dog with?
Yeah, the little one.
Well, yeah. So that's what I was going to talk to you guys about too. So let's talk about pentoxyphylline. Is that how you say it? Right, Jen?
Pentoxyphylline.
You gotta go your syllables. Pentoxyphylline.
I used to say pentoxyphylline. I got told it's not called pentoxyphylline. Kelly Clarkson, what? It's like pentoxyphylline.
No.
No.
I thought it was pentoxyphylline, right?
They had an accent. No.
Yeah.
Yeah, it
That's
totally.
wonder- Okay, so the dosing is a little bit all over the place with pentox, but I do 10 mg per kg BID. You know, I don't do TID. Do you guys do SID?
BID.
BID?
BID.
I do BID, yeah.
Yeah. I mean, that's that. Well, first I did Convenia because why not? Why not?
It doesn't hurt.
Won't hurt anything.
Right. Yes. And then there's what I usually do now that I know that I see this more, I also prescribe tacrolimus too. Does any of you prescribe
Yeah.
it?
Yeah, that's awesome stuff. Awesome sauce.
Tacrolimus for some ophthalmic issue? I mean, like you're putting it in the eyes, or you're putting it on the ears?
Topical.
Oh,
Topical.
topical. Okay.
Topically.
Okay.
Yeah. So you can use acute because it's expensive too. Like I just priced it to, it's about $125. So it's an expensive tube, but I tell the owners, make sure you wear gloves, and you know, a Q-tip is really works well too. So, but because most of 9 times out of 10, they're really small areas that they're affecting it. So, and I said, there's a good chance that may happen again. So that's why it's good to have this on board. So I've done that. And then I also do niacinamide too. So the tetracycline niacinamide combination works well too. And I can give you like the doses. I think I have it in my outline too. I have one of my, Dr. Shapley, I think you were prescribing fatty acids because I used to work with him too. And so
Yeah.
Fatty acids was a big thing we were talking about too, I know, right?
Fatty acids, yeah. And I will admit, I'm an integrated practitioner, so I practice Eastern medicine as well as Western, so acupuncture, herbs, all that kind of stuff. So I tend to try to reach a little bit more on the side of like omega-3 fatty acids, Chinese herbs, things like that when I'm approaching a case like this. I'll reach, a lot of times I'll reach for that first with a lot of success.
Remember when I saw the one case to you and I was like, because there's one that was coming down and I'm like, grab the Union Bio.
Yeah. Yuan Biao, it's some magic.
Right. What are you all treating? How are you treating it? Anyone?
I haven't seen it because nothing that I touch gets sick and or dies.
Right, it's amazing.
But if I did,
You touch anything? Wait a
don't.
minute.
Why do you got to ask that question? But if I did, I mean, I'm an emergency vet, like originally, so I would just smack it with a buttload of steroids. I know it's okay. Judge me. I'm comfortable with it. I mean, I was real pleased to see dexamethasone in the news.
Oh yeah,
Right.
that picture. That picture looks more like it.
Yeah.
Yeah.
Right.
That's what it
Yeah,
is.
I've actually used a lot of pentoxyphylline and have had pretty good success.
So
You did
here's
a
my
great job
question.
with the ear though. Overall, with the surgery, you did. It looks good.
Oh,
Yeah.
yeah, thank you. My question on pentoxyphylline, do you guys get it compounded? Because it's 500 milligrams, and so it's a little tough to give to like the little guys.
Yeah, yeah.
'Cause I usually like, give a quarter of a tablet or whatever. What are your thoughts on that?
I've usually I just quarter them or half them or whatever, but I have in the past compounded.
Okay. Yeah, I was just curious to see because there's all different ways of doing it. Yeah. Stop sharing my screen here. But wait, but first, hold on.
So how long? So if you're because this was your kid, right?
Yeah. So this was.
Oh.
I know. Here they are. Where is he? So this was Connor. It's this one that I brought. Actually, let me bring him here. I'll show you his ears, what they look like, so that way you have an idea.
That way, if he brings him on, do we get to charge for a telemedicine visit? No.
I don't think so because it's after the fact.
I mean, a consult's a consult.
I love the ability to try to find that revenue, though. I think
I know
Hello.
we should all charge for our time, right?
A girl has to eat. Okay.
Right. Yes. So if I show you his ears, can you see?
Oh
Yeah.
my gosh.
Mhm.
Uh-huh.
And then this is his other one, too.
But you didn't have to take off very much.
No, you didn't.
Not
I
at
did it
all.
with him. No,
That's
I
a
didn't it with
different
him.
one.
No,
Okay.
different one. Not one of mine, but a patient of mine. But this is another one too. Do you see this? Hey, little to the left, to the right. But I see this a lot with new graduates. By the way, is this thing out? No, it's not out. Okay, but I was like, we are drinking, so I'll buy you a drink. But
Aw.
But this is right. This is acanthosis nigrans, and so like the new graduates think that this is like they put dachshunds on like antibiotics right away. But I say cytology everything because you'll have like a benign cytology. It's really nothing. So I don't do anything with it, So I'm like,
Well, you do. We have to talk to the owner and
Right.
let him know what's happening. Because,
well, yeah, they'll come in. So dachshunds will come in, but like pet owners will be like, oh, my dog's got hair loss and skin infection. And it's really not. If you do the dermatologic database, you just figure, kind of rule things out, of course, bacteria, yeast, all those different things, atopic dermatitis. But yeah, so that's what I did. This is Clark W. Griswold.
Is he on
Shaw,
vacation?
I love his baby.
Carrie. Look at Carrie's mouth.
Carrie
He's got a
bothered
sure pay.
Well, all I can see is her butt.
Aw.
Hey, show her face.
Oh,
What kind
Aw,
of dog is
Sharpie
that?
baby.
Yeah.
what a cute
Oh,
pup.
my dog.
Okay,
That's adorable.
everybody bring them on out because we're
Right.
getting towards the end. So everyone, this is your chance. I don't even know where mine went.
Charlene is shy. She will not come on the camera unless she's prepped and ready.
Oh, well, look at you.
Oh, look at that kitty.
Oh,
baby
cat. Girl,
Oh,
oh,
and why
Kitty in a
do you
box.
have the
In a-
cone? Dimitri, you gotta
in a cone.
tell us why the cone, man. You gotta put it on there. We gotta
Yeah.
we gotta know why the cone.
Hello.
Hey.
Okay. My English are not very good. I will try to make you understand. She had dermatological issue with her ears, and I think that she had an allergy problem, but I cannot find out yet if it's from food or from weather. And I now have, because we had exams, I didn't really have the time to search for it.
Yeah.
But so I have to wear her the collar, so the cone, so she stays out of sorry.
So she doesn't hurt herself.
Yeah.
Yeah,
So she stays out of trouble. Yeah. Good.
I try to find out. Maybe I have to test the food first, change her food, and then we will have the time to search more. I don't know.
Yeah.
I hope everything goes well.
You're on the right track.
Thanks
Yes.
for zooming in all the way from Greece. That's amazing.
I love it.
Thank you very much. I'm glad I found you online and I can have these experiences
Yeah.
through
Awesome.
Zoom.
Awesome.
This is absolutely awesome. This is exactly what we're all about, to share these stories, and we want to do more. So one of the things that we also have a rule on the Bridge Club is that we don't take all your time, because to the exact point of what Adam started this conversation of, your time is incredibly valuable. So we try to keep this less than an hour. We're quickly coming up on our hour. So we start and end every single Bridge Club with a toast. It is, believe it or not, there is science behind it. So while we are talking science this evening, but most of us by this point have very few drops left. That's okay. If you're smart and you come to the Bridge Club a lot, you have a backup. So you always pack backup, because you know this is going to happen. But what I do want to say, for our inaugural medical mystery, what I'd like you to do is go into where it gives you the reactions at the bottom. I'd love what you guys think. There's a lot we can be doing to really evolve this, but I love the size of this group. I love the conversation. Should we keep doing these? Love to give us like an applause or a thumbs up if you think we should keep doing these. And if you have suggestions on topics, please, yay, that makes me happy. Please, please, please send me a note. I'm super easy, Catherine@thebridgeclub.com. If you've got a tough case, let's bring it forward. It's all about the education. Adam was so great to be our guinea pig here. And it was such a great story. And I love Adam as a human being. And so I love the fact that we could bring this forward. So I'm all for it, guys. The more we can do, the better off, and we elevate the profession. So no pressure, Adam. Last toast, make it a doozy.
Gosh, my goodness. Well, I mean, we all talk about the value of time. There's always one thing that I say with time is to thank somebody. So always, always thank someone, because we just don't know what everyone's going through these days in these trying times of a pandemic. So thank somebody for their time. Thank you for their worth. And we have Veterinary Technician Week coming up. So thank you to the technicians, the assistants, and the hospital managers for all your hard work in those trying times. Cheers to everybody.
Cheers, everybody. You guys, thank you for giving us your time tonight. And if you have any final thoughts, go ahead and throw that into, oh my God, 6 a.m. in the morning. So Ruth, is it Ruthie? Where are you at? So I'm going to ask her to put that in there, 6 a.m. in her country. So I want to know where she's at.
I know.
Because this is so much fun.
Oh,
so
India.
before I
I
can
was
dial
gonna
up.
say it's in the east.
Yes, I know.
Welcome. Wow, we are so global right now. I'm loving it.
I know her.
Very cosmopolitan.
Oh, you know, well, Adam, it's all you. And thank you for coming. Everyone, absolutely thank you so much. And so with that, everyone, have a great evening, morning, afternoon, wherever you are. Thank you for joining us.
Thank you, everybody.
Good night, everybody.
Good night.
Everybody.